MitraClip is a treatment for some people who have a leaky mitral valve. Doctors may also call it mitral TER, which means transcatheter edge-to-edge repair. That name sounds complicated, but the idea is simple. Instead of opening the chest for heart surgery, doctors use a thin tube called a catheter to reach the heart from a vein in the leg. A small clip is then placed on the mitral valve to help it close better. The mitral valve sits between two chambers on the left side of the heart. Its job is to let blood move forward in one direction. When the valve does not close tightly, some blood leaks backward. This is called mitral regurgitation. A small leak may not cause many problems, but a severe leak can make the heart work harder. People may feel short of breath, tired, weak, or unable to walk as far as before. Some people may also have swelling in the legs or repeated hospital visits for heart failure. There are different reasons why the mitral valve can leak. In some people, the valve itself is damaged or floppy. In others, the valve leaflets may be mostly normal, but the heart has become enlarged or stretched, so the valve no longer closes well. This difference matters because the best treatment depends on the cause of the leak. MitraClip is not for everyone with a leaky valve. Before recommending it, doctors look carefully at the patient's symptoms, heart scan results, valve shape, heart pumping strength, lung pressure, other valve problems, and overall health. A group of specialists, often called a heart team, usually makes the decision. This team may include cardiologists, heart surgeons, imaging specialists, heart failure specialists, anesthesiologists, and nurses. For people whose valve is damaged but who are healthy enough for surgery, surgical repair may still be the best long-term option. But if surgery is too risky because of age, frailty, or other medical problems, MitraClip may be considered if the valve shape is suitable. For people whose valve leak is mainly because of heart failure or an enlarged heart, doctors first try to improve the heart with the best medicines and, when needed, special pacemaker therapy. If the person still has severe symptoms and the valve still leaks badly, MitraClip may then be considered. The procedure is usually done in a special heart catheterization laboratory or hybrid operating room. The patient is given anesthesia or deep sedation so they are comfortable. Doctors use ultrasound pictures from inside the food pipe, called transesophageal echocardiography, together with X-ray guidance, to see the heart and guide the device. The doctor starts by placing a thin tube into a vein near the top of the leg. The tube is gently guided up to the heart. It reaches the right side of the heart first. Then the doctor makes a small controlled opening in the wall between the right and left upper heart chambers, so the catheter can reach the left atrium, just above the mitral valve. Once the catheter is in the right position, the clip is moved above the leaking part of the valve. The clip arms are opened, and the doctor carefully catches the front and back valve leaflets. When the leaflets are held together, the valve can close more effectively. This usually reduces the amount of blood leaking backward. Sometimes one clip is enough. In other cases, more than one clip may be needed. Before releasing the clip, the team checks the result very carefully. They look at how much leak remains, whether the valve is opening well enough for blood to pass through, and whether the clip is stable. If the result is good, the clip is released and stays attached to the valve. The catheter is then removed. The goal of MitraClip is not to make every valve perfect. The goal is to reduce the leak enough to help the heart work better and to improve symptoms. Many suitable patients feel less short of breath and can do more daily activities after recovery. In some people with heart failure-related valve leakage, studies have shown fewer heart failure hospitalizations when patients are chosen carefully and continue good medical treatment. Like any heart procedure, MitraClip has risks. These can include bleeding, blood vessel injury, stroke, infection, damage to the valve, need for another procedure, or rarely death. The risk level depends on the person's age, heart condition, other medical problems, and valve anatomy. That is why careful testing and shared decision-making are so important. After MitraClip, care does not stop. Patients usually need follow-up visits, heart ultrasound scans, and continued medicines. People with heart failure still need long-term heart failure treatment. A healthy lifestyle, salt control when advised, regular activity is allowed, and reporting new symptoms early can all help. The main message is this: MitraClip is a less invasive way to treat a severe leaking mitral valve in carefully selected patients. It can reduce the leak, improve symptoms, and help some people avoid repeated hospital visits. But it is not right for everyone. The best decision should be made with a heart team that understands the patient's valve, heart function, general health, and personal goals.